Anopheles stephensi, breeds in containers, cans, jerry cans, like even, this kind of tires.
If it got established in the African setting, then we would have malaria taking place both in the rural areas and urban areas, and that would be a huge problem.
And this is because mosquitoes know no borders, so action needs to be decisive, disciplined, and sustained.
Welcome back to Africa Science Focus. I'm your host this week, Sally Amutabi. In this program, we investigate warnings that Africa has just months to react to an invasive malaria mosquito that scientists say could put 125 million city dwellers across Africa at risk. Michael Kaloki reports.
I'm walking here on the streets of Nairobi, the capital of Kenya. Over the years, malaria has been a concern for the authorities here in Kenya and several other countries in sub-Saharan Africa. Now there is an Asian mosquito known as Anopheles stephensi that has been identified in the Horn of Africa. The Anopheles stephensi is one of the few malaria mosquitoes that is known to thrive in urban areas, and experts are worried that it could quickly spread across the continent. So what is known about Anopheles stephensi and what can be done to manage it?
Hi, my name is Marta Maya. I am a medical entomologist working with the Kemri Wellcome Trust research program in Kilifi, Kenya.
Marta, your main research interests include malaria vector bionomics, control and surveillance. What do you know about Anopheles stephensi?
Anopheles stephensi is traditionally an Asian mosquito. It has been found in the Horn of Africa. It was introduced around 2012 into Djibouti, and it is currently spreading across the Horn of Africa, and it may represent a very big problem for urban areas in Africa. Unlike the African vectors Anopheles gambia and Anopheles funestus, which breed very well in rural areas and not so well in more polluted and urbanized areas, Anopheles stephensi is well adapted to urban dwellings, and because it breeds in containers, areas where malaria is no longer a big problem may see a resurge in transmission due to this invasive mosquito. Also, Anopheles stephensi are quite adaptable. They may feed on humans or animals, depending on their availability. They also feed regularly outdoors during twilight hours. And so what we currently use against malaria vectors, which is mainly bed nets and indoor residual spraying, these interventions may not be adequate to control this new invasive species. And even the traditional surveillance methods, which consist mainly of placing traps inside households, they may not be the best method to monitor this vector because of their biting behavior.
So far, there has been little research on the behavior of Anopheles stephensi in sub-Saharan Africa, as Dr. Meshesha Barkiu, the Vector Monitoring Director at the Vector Link Project in Ethiopia, explains.
We have, in fact, a gap in understanding its resting behavior because, the surveillance methods we have are not efficient for studying behavior of Anopheles stephensi, the adult behavior. But we know that it rests in animal shelters. It is associated to cattle and goats.
Doctor, are there any characteristics that make Anopheles stephensi unique as a vector?
Yes, there are four. I can say that there are four factors. One is its adaptation to new environments. The recent history, even to Djibouti, where the temperature is very high, and even in the eastern part of Ethiopia, which has a similar environment to that of Djibouti. And the other factor is it is breeding in artificial containers, And the other one is it is feeding behavior, It feeds both on cattle and goat and humans. And this helps it is, to increase its density and abundance, and to also to increase its efficiency as a vector. The other one is studies in Ethiopia showed that in laboratory and field studies, the infection rate is very high. The sporozoite infection rate is highly susceptible to parasite infections. Even it is more susceptible than Anopheles arabensis.
New mosquito species only pose a health risk if they are able to spread local malaria parasites. To the surprise of researchers, the Asian mosquito Anopheles stephensi appears to be highly efficient at this, adapting quickly to its local environment.
Meshasha, you noted that Anopheles stephensi is resistant to the conventional insecticides that we're currently using on the continent at the moment. Does that mean then it poses a high risk of spreading malaria around the continent generally?
We can speculate that, but we don't have information for the moment. What we can say at this time is that it is spread, it invaded urban areas, and implementation of intervention in urban areas is very difficult because people are not willing for even we have an insecticide which could be implemented for this species, but in fact there are new insecticides like Sumishield and Fludorafigin. We don't know yet if these insecticides will work for Anopheles stephensi. And the other one is bayonets. As I said, it is highly resistant to insecticide for bayonets, but the good thing is that there is also an opportunity to use natives. But in urban areas, people don't tend to use nets. And for one thing, utilization is very low, and the other thing is accessibility is also very low. That's what we can say about this.
Next, I'll be speaking to Professor Clifford Mutero from Kenya. Professor Mutero is the coordinator of the Integrated Vector Management Project within the International Center of Insect Physiology and Ecology's Malaria Program. Anopheles stephensi has been identified in some countries like Ethiopia and Djibouti. What do you feel would be the most appropriate and immediate steps that need to be taken by these countries?
The countries need to set up surveillance systems, vector surveillance systems, so that they can locate where this species is spreading. They can do that quickly if those systems are working, and that would enable them to direct the resources in a strategic manner, because if it gets distributed all over the country, then it becomes very difficult to control.
Matamaya agrees with Professor Mutero.
They have to make sure that they have adequate teams in place who can recognize this vector and can sound the alert. And also in terms of capacity within the laboratories to do molecular work to find out is this to confirm that this is stephensi, because they might be confused with the local vectors. I think this capacity needs to be there. And once they do find these vectors, they have to have again, a capacity to targetedly control them. And this can be done through larviciding, because we know that they breed in containers. So very much what we see with vectors of dengue and chikungunya that also breed in containers. So the same type of larviciding efforts need to be done. And basically you need a think tank. You need people who are involved, scientists who are involved with the public health authorities, helping monitor the ecology and the behavior of this vector to prevent that it spreads.
Are neighboring countries and governments across the region aware that Anopheles stephensi has been identified and could potentially spread?
Many of them are now aware through the national malaria control programs. And the way it happens is that those programs normally work with research institutions, and information is being published even as we speak on this species. Many research institutions have responded to the World Health Organization's alert for this particular species. So the first peer-reviewed scientific papers have started appearing, and the governments in Ethiopia, Djibouti, Sudan, as well as in East Africa, Kenya, Uganda, Tanzania, they are aware.
The World Health Organization raised the alarm on urban malaria transmission in 2019, highlighting the need for aggressive action against Anopheles stephensi as a top priority. It described the species as a major potential threat to malaria control and elimination in Africa. So, while experts prepare to battle the mosquito in the field, efforts are progressing in the lab to eradicate malaria once and for all.
And as you might be aware, a partnership has been forged to work on an mRNA malaria vaccine, which it is hoped will be produced in Africa. How could this help in the fight against malaria?
We've, for a long time, been looking for new tools to combat malaria. We've got those that take care of the mosquito. We've got the curative drugs for the disease. We have not been lucky with a vaccine. It's been elusive. And yet, this, if it was available, could be the game changer.
I think this is great news. Firstly, I think vaccines are the most cost-effective public health intervention. The development of a malaria vaccine is a great challenge, and the more groups and the more new technologies that are explored that may work on this terrible disease, that it higher the chances of success. So I think this is absolutely fantastic. The COVID-19 pandemic showed us that with the right partners and the right political will, there's enormous achievements that can be made in relatively short periods of time. The transfer of mRNA technology to malaria vaccine development is fantastic, although it is not guaranteed to work. I think that before we get excited, we still need to acknowledge that there's still a lot of research that needs to be done and a lot of clinical trials that lie ahead. The fact that the vaccine potentially will be made in Africa, I think this is great. But I think that this could be an opportunity for even other vaccines, not just mRNA vaccines, to be done in Africa. There's a need for capacity so that we don't rely on third-party countries to provide or to produce the vaccines that Africa needs. There is already a lot of capacity in the veterinary field. It is now just a question of political will to transfer this capacity or to mimic this capacity within the human field.
That was Marta Maya, ending our update on Anopheles stephensi. That's it for Africa Science Focus this week. In our penultimate episode of the season, you can catch up on the rest of the season with your favorite podcast app. Today's program was produced by Harrison Lois and edited by Ruth Douglas, with reporting from Michael Kaloki. Africa Science Focus is produced by SciDevNet and distributed in association with your local radio station. I'm Sally Amutabi. See you again next week. This program was funded by the European Journalism Centre through the European Development Journalism Grant Programme with support from the Bill and Melinda Gates Foundation.